and I am the chairwoman of the Illinois 4-H Youth Leadership Team. Today, I'm here with Dr. Ngozi Ezike, the director of the Illinois Department of Public Health, to talk about COVID-19 as a part of our 4 Things to Know series. So we have several questions that have been submitted by Illinois 4-H members, all about the impact of COVID-19 on youth. So Dr. Ezike, thank you so much for joining us today. Could you begin by introducing yourself and your work?
Thank you. My name, as mentioned, is Ngozi Ezike, and I'm so proud to serve as the director of the Illinois Department of Public Health. This is one of many state agencies that form the Illinois state government. Our agency is dedicated to serving the people of Illinois to help them promote their best health. So we operate in many spheres of your everyday life, which many people may not acknowledge, whether you're, as we're getting closer to, lake or beach season, we make sure that the water that you're going to enter is safe to enter. We make sure that we're on top of it if there happens to be a food outbreak. We make sure that babies immediately upon birth are screened for dozens of health conditions that need to be identified quickly, sometimes to intervene with life-saving therapies to save that baby's life. Of course, we're involved with, health screenings, whether it's for cancer prevention, HIV prevention. We're studying the causes and effects of maternal mortality, infant mortality. So many things I think that people maybe don't think about, but that we are behind the scenes trying to make sure that we can promote wellness and prevent disease. And of course, everyone has become a little bit more familiar with our work in trying to combat the COVID pandemic.
Awesome, thank you. So our first question, do young people still need to worry about COVID-19?
Yes, in fact, everyone still has to be concerned about this virus. Teens, young adults, all need to do everything that they can to protect themselves from COVID-19, because while the disease has taken its heaviest toll on older individuals and people with known chronic conditions, we have unfortunately seen severe disease in much younger people as well. And there's really no way to perfectly predict how COVID-19 will affect any individual. So to reduce the amount of the virus that's circulating in our communities, it's important for as many people as possible to get vaccinated, including our teens. And this is how we will get back to all the great 4-H programs and all the in-person activities that we typically have been able to enjoy.
Thank you. And as you mentioned, the vaccine is really important for us to get. So what are the most common side effects from the vaccine for children and teens specifically?
Yeah, no, so that's an important question. And I know people are concerned about that as they, move forward with vaccination. But I also want to make sure that we highlight some very significant side effects that we have seen from COVID disease. And so understanding what both can cause will help people make that great risk benefit, analysis as they determine, which is the better option to take their chances, from getting COVID versus taking the vaccine. In general, the vaccine has been shown to produce many of the same side effects that we see with other vaccinations. The most common and most consistent symptoms that are reported include, obviously pain at the injection site where the needle was inserted, swelling, redness. People have also gone on to report, fatigue, headaches, some muscle pains, even some fevers and chilled, very, very time limited, that don't last for a long time at all. And then of course, some people have zero side effects at all. And again, all of those symptoms are just a reminder that your immune system is working, is revving up to get the intended benefit of the vaccine, which is to prevent, severe illness, hospitalization, or worse, which are things that have happened, obviously, with COVID disease. And even in the absence of severe disease, we have had these many individuals report having lingering symptoms for months and months and months. I've seen several people who said that they lost their sense of smell and taste, and that lingered for up to 3-4 months. Some people have said that the body aches associated with the actual infection lasted for many months, so debilitating that some couldn't go on to do their regular activities. And then some have described this COVID fog, or this, fuzzy brain, where they are not thinking well, their memory is off, they can't remember certain simple things, and have had that persist for a while, which can obviously impair school functioning and or work functioning.
I think that's an important distinction to make, to highlight the side effects of both the vaccine and COVID. So jumping from that, what vaccine is most effective and safe in children and teens?
Well, right now, that's an very easy question, because there's only one vaccine that's currently authorized for individuals under the age of 18. And so that's the Pfizer-BioNTech vaccine that goes down to the age of 12. So 12 to 17-year-olds can get that. It's a 2-dose series separated by at least 21 days. And we are hearing that there's a second vaccine, the Moderna vaccine, which recent clinical trials just suggested that it was up to 96% effective in young people 12 to 17. So we may, in due time, have a second option. But for now, it's the Pfizer vaccine that's available for individuals under the age of 18 down to age 12.
So you mentioned that it's available for youth 12 and older. So when do we expect that kids under 12 will be eligible for that vaccine? And the second part of that is, what is the best way that we can keep our younger siblings or our family members that have a compromised immune system safe?
Yeah, so that's very important question. And of course, we have heard that the vaccine companies are they're actively doing trials now, trying to go down to 6 months. And so they are looking at different age groups, I think 6 months to 2, I think maybe 2 to 5, and then 5 to 11. I think we are going to have information soon in terms of, which dose would be appropriate for those different age groups, and, will that get the authorization as well? So we are hoping, fingers and toes crossed, that there might be information regarding that this fall. So maybe just a couple of months. But in the meantime, what can we do? And the best way to help someone who cannot be vaccinated, or maybe who got vaccinated, but they didn't build up a good immune response because of a condition that they have, the best thing that we can do for those individuals is get vaccinated ourselves, if in fact we have, no contraindication to getting vaccinated. And so getting that vaccine is the safest and most, one of the most effective vaccines that have ever been developed. And to get back to normal, we want to do that. And then, all the things we want to maybe continue with: washing our hands, think very, very intentionally about the settings that you want, that unvaccinated individual to be in. In addition to continuing to wear a mask, you might want to avoid super large crowds where there may be the possibility of having spread, because again, we don't know who's vaccinated and who's not. And we also know that we can't fully identify if someone could be completely asymptomatic, meaning that they have no symptoms at all, and still have the infection and still be able to pass it on. So, again, thinking about all these different things, of course, washing your hands and then keeping hand sanitizer to be able to continue that hand hygiene is really important. But the bottom line is that we all need to follow the example that the 4-Hers are setting, in order to remain healthy and to help our clubs and our communities and in our country. We have to tackle this virus by using our heads, our hearts, our hands, and health. So Illinois 4-Hers, please get the vaccine and continue to make the best 4-H state, Illinois, even better than it already is. Thank you.
Thank you so much, Dr. Ezike. Those are some excellent points. We greatly appreciate your time and all of this information about what we as youth in Illinois can continue doing for COVID-19. So thank you.